The doctor's office didn't like home care class because they want an update, no one wants to update, and they wanted the nurse because of the meeting, no one is available. So they said, discharge the patient, we're sending DNA now. Yeah, that's the story, yeah.
We're in the dark, huh?
It's too hot. I don't know, we really can't, I really didn't think about it, I walked in here and then everybody else.
But I feel like I could have went to church.
From home here class. Start them.
I know what you
Stand by.
You know, Linda was so upset, like, I called her name. She said, you're calling down on the phone. I said, I'm so sorry. Sometimes I'm going to see the patient.
What doesn't happen?
Yeah. Yes.
There was a time in my life that I walked
It's a good one.
Oh, wow.
I'm poking fun.
Yeah.
Are we starting?
I got in.
Am I pressing that? Do you want me to?
No, I guess I can press buttons. No. And after somebody else and you moved in, so that's fine. I'll do it.
One's in the hospital and one's still.
I think I'm okay.
Yeah.
Can I start?
Yeah. I got 3 IV patients.
And we're eating pizza. Pizza for the pictures. Both things. They look
Oh,
like,
I'm sorry.
they look like
No, there's no more pictures after this.
They look like
This is only about charting, so you don't have to worry about pictures. This is
Close
just
your
for.
eyes when you're taking a bite.
Oh my God.
How are you? Share with somebody else. All right, well, I'm fine. That's good.
Are we ready?
Listen, I went to where does it stop and where does it end? Well, I heard, and then yeah, because I have 2 more to do. So I'll tell you something though. I don't sort of line up its order, so I didn't know. So I did one. The first night I did, you say it was fine. The second one, it was hard.
Yeah, I read you because I visit for today when you put the care class. So I did it last.
So I thought everybody wanted to, I was going to say, if anybody wanted to. I wanted to. Sometimes I can notes again.
This will be good with no Wi-Fi.
I'm not a stupid person.
I tell you, you're just to let you know you're like being videoed right now. Just so you know. Well, you can be, or move back, go up against the screen so you're part of the video. Yeah.
He was like half of it did, but I thought to myself, you should just do it, you gotta drive.
Hi, everybody. Hello. Just saying hi. Got you guys some pizza. So I figured you could all use a snack. Don't forget about Care Connection, especially when you have clients that are soon to be discharging from the VNA. A great time to talk us up. Hey, if you need a little extra assistance. The way I put it when I go out to clients' homes is I say Care Connections is an added layer of service offering home care by the Stratford VNA. Always remind them that we're part of the Stratford VNA. That seems to bring them a lot of comfort and instill confidence in us. BNA still tends to be the lion's share of our referrals, so I am super dependent upon all of you guys plugging us out there in the fields, okay? There's a bunch of brochures, and that's it. I'm gonna be on my way.
Thank you.
Thank you.
Okay, so I was asked to do this. It's not on like wound care itself. It's really on charting for wound care. So I'll try to keep it brief. So the first thing we're just going to look at are reasons why we're doing this. So I guess you could say the mistakes we've made, kind of thing. So these pictures are actually pictures I got from Michelle. There's 3 of them. I don't know this patient, but do you want to tell the story or just the background, or you want me just from what I know? Yeah. Okay. So it's a patient who has. Do I have to answer this now?
No.
Has,
That's me, sorry.
has nursing and had a nursing visit, I guess, that day. And then later on, one of the physical therapists went out and they had a boot on, right? Had a boot on.
Yes.
And the physical therapist noticed that it was really, really wet and weeping, so took the boot off to see what was underneath, and this is what he found. So the reason this one is included is just we need to look at every place on the patient. You know, they can refuse, I guess, they can. But we do need to look around, and if they have, you know, a boot or something on, we have to take it off and we have to look at it. Also, this is like somebody who could use a lot of soap and water, I think, on their legs. Maybe some lotion.
Between the
Stuff.
toes.
Well, the
And
problem
between
was
the
the
toes.
patient had a
Yes.
cast
The toes were
on.
gross. So like floss, toe floss, soap and water between the toes. Like Dr. Birch used to say all the time, toe
So
floss.
the patient had a cast on previous.
Okay.
Yeah.
Cast got removed the day before, and then went to bed, woke up with his legs soaking wet. He wrapped it and never told the nurse who went out until the therapist went out and went, why do you have this on
Yeah.
here?
because you went out that night.
Yes, I did. That's why I know those legs very well.
Found it.
Never on call, I had to go out. and
So also another thing, not just because they have a boot on, but also the patient had a cast on, now has a boot on.
Right,
Another change.
you know,
Patients
That
aren't
was
gonna
not
tell
happy.
you that that's under there, and that was weeping so much.
It
The
was bad.
boot was completely saturated, it was leaking onto the floor.
yep, therapy had to go out and get another boot.
Sorry, Deb.
Yes, that night.
Yep, that night, he went back and brought a boot out.
So don't expect the patient to tell you something's under there, even though he knew it was under there, and he had multiple openings like that.
He wrapped his leg up, cause his bed was wet, so he wrapped it up with Curlex and put his boot back on.
The ortho gave him the boot because the boot took the cast. They took the
Yeah, like
cast
a
off of a
walking
walking
boot.
boot. Yeah, not a
Yeah, like a
shoe.
walking
Like a
boot.
camp boot, see,
It
and
was a
boot,
camp boot.
Yeah,
Then
the
why
camp
didn't
boot.
the ortho say that they were?
He doesn't
Apparently
think,
there were no rules.
there were none, he said
Oh.
that they developed during the night.
Oh.
Yeah.
He could have had just some fragile skin there.
Right,
You know,
they
Maybe,
busted up.
They're still not healed either. It's
They're
been
not?
on
Wow.
I think
a
there's
couple months.
3 of them, yeah.
Yeah.
That's been a while.
He had 3 wounds.
Were these from like friction tears from the boot, or was it skin tears when they took the cast off?
No, he said that when he came home, there was nothing there, he went to bed and woke up with them soaking wet and
So
open.
probably
Probably
the
the
skin.
skin,
Probably friction
yeah,
things in the boot.
friction from maybe the sheets on the
And
bed.
if I was itchy, so he probably
Yeah, the boot
scratched
on.
during the night.
Huh?
Yeah,
Probably,
still.
because
I would
the
say
skin is
So
so
you wouldn't
dry.
take from the sheets?
I know he did not have the boot on at night.
Oh, okay.
No, no boot on at night.
Yeah. So
They're
also,
terrible.
they're not included, but a couple weeks later, we had more pictures and that dry skin was still there. And his toes look 100% worse than that dry skin. So we asked the nurse, you know, we need an update, send us a picture, and we got the picture. I was like, clean his toes. What are we doing? You have to wash it, lotion it. We can't leave skin like this, or you can kind of see the top of his foot, how bad it is. But he had just dry skin and gunk between his toes, and we were going there, doing wound care a couple times a week and assessing those toes, and that's just sitting there. And we're also not looking between his toes. And he already lost his other leg. He only had one. This is his only leg left.
Sometimes that skin doesn't come off in all honesty, cause I have a patient whose toes are disgusting, I mean, Kat knows this one. And no matter how much I wash or soak his feet in between my visits, they just don't.
And depending, I mean, maybe it's some aquaphor on there, it will soften it, but it's not something we can just leave, and no one was washing his
Oh,
feet.
okay.
They admitted they weren't doing it.
Okay.
So, you know, look around, it's not just, okay, cast, cam boot, you should be looking under there, but also he already has one leg. He already has perfusion issues, and we can't leave the rest of his leg looking like that either.
I know with time, if you take proper care with washing and cleaning and drying and that lotioning, it will improve.
Yeah.
Oh,
If
it's
it's
a
a
lot,
regular
yeah.
visit, during the visit,
Yeah.
regular.
Yeah, they gotta do it
You're not gonna
themselves
get that
too.
off of one,
You know.
one visit, yeah.
One of the other issues is measuring. So Debbie's here. Everybody knows Debbie. Does everybody know Debbie? Everybody. So Debbie does a lot of QI investigations, and one of her thing is measuring. So we have to measure at least once a week, but there's times she's not finding that. So we're going to talk about that today too. Does everybody know? We're going to get to it. We're going to actually put a wound in. We're going to do a care plan. But does everybody know where their measurements go?
Yeah.
Answer. Go ahead.
Yes.
On the flow sheet. Okay. So if you're here and you're putting it in on the flow sheet, I don't know, say it's Thursday and you're not measuring every day because they've got 20 wounds, so you're only going to measure once a week, let's just say. How would you know when it was measured last time?
History.
Okay, perfect. So you hit the history and that will show you the last time it's measured. So I know that for orientation, I tell people hit the history. You can hit it on every screen. Like for all those COVID questions, if they've already been answered and they have all their vaccinations, you don't have to put them in again. But hit the screen so that you know exactly when something happened last. And then you can see what people filled in the screen the last time too. Okay, our other issues we're having are the wounds, labeling them. So like this one, they've got several that are labeled the same. So we actually were kind of talking about this. These are different wounds, definitely on this gentleman, because
It's
see
so
how
hard to
the
tell.
X is moving?
Yeah.
So they are all definitely different wounds, but the problem is if somebody's going to review the chart or look at it, it's very confusing to them. And it's also confusing to the next person that goes. When you have the iPad in front of you, you could see the X and you could see where the wound is. But if a reviewer came in, they're not looking in the iPad, they're looking here, and they don't actually have that whole picture of that patient. You know, the little man
The body
on
doesn't
there,
show
the
up.
body. So it's hard for them to see. So one of the things we're talking about is labeling them, which part of my screen got cut off. We're going to get to it. But you know, there's something down here that's additional information, and we could make it number 1, number 2, number 3.
Oh, good.
Really for, like if it's all on the left leg. If you have a head, a knee, that's easy. But if you have like 3 wounds on one leg, we should have like number 1, number 2, number 3. Does that make sense?
Yeah.
Oh, yeah.
Okay, so we're going to do that too.
Okay.
We're going to show you that.
I need to look at
Other problems are the way that our wound cares are actually written. This one says left lower leg wound, cleanse with normal saline or soap and water, apply Neosporin topically in the morning, Episerum cream topically at night, and cover with dry clean dressing.
daily.
Right? Because it says at night and morning, it's daily, but who's doing it?
Yeah.
I don't know who's doing it. So we need to know who's doing it, and they need to sign their little form that they've learned how to do it, even for creams. Because if we have a wound care order for this, and somebody else is doing it, they need to sign their competency form. So we're gonna look at that. This is the big one. I think this is the big problem you had, Deb, which it wasn't like we don't want to say it was a problem because the patient was being seen, but it was the way the order was written. So this is somebody with a Dakin's, and this happened with Dakin's, and a wound vac. It happened with 2 different people. So they have the order's great, okay? Perform wound care dressing change, irrigate with half-strength Dakin solution, applied barrier to peri-wound, 1 piece of white foam to wound bed, followed by 1 piece of black foam. Oh, make sure you read before you send it in. We've had some issues with some inappropriate words, which I think some of you have seen. White foam to wound bed, followed by 1 piece of black foam, bridge suction to hip, suction to be set at 125 continuous, great. But it says 3 times a week, Monday, Wednesday, Friday. The patient wasn't seen on Monday, Wednesday, Friday.
So you didn't have an order to do it on another
So
day?
just leave it 3 times a week.
3
3
times a week.
times a week or every 20?
3
No,
times a
don't
week.
say every so many
But what if, can we do like a range of 2 to 3? What if they go to the wound center once a week?
We're gonna talk about that.
stayed there.
Yes.
Except on weeks.
Yes.
Once
So,
a week when patients-
Yes, that's okay to do?
well, no, because you can't do a range. If they have to have a wound vac 3 times a week, then you have to have that in your order 3 times a week. You can't say 2 to 3. But you would have this in here and you would say 3 times a week to be performed by Stratford DNA unless
Oh.
goes to the wound care center, the doctors, dermatologists, whoever else does their wound.
Oh, okay.
It still needs to be 3 times a week. You can't say 2 to 3 because the
So
orders
not
are
to write
3
also
times
the
a
wound
week.
care center will say 2 times a week by VNA, 1 time at home care
Yes.
center.
What happens?
No,
Well,
because
no,
what if
They
it's a
get canceled, when they
holiday or
cancel,
they
I'm
don't
all of a sudden, you
go?
know?
no, it's 3 times a
Because
week.
I remember when we had an in-service before, you mentioned like whatever the wound care center sends you an order, write it in the care plan. So that's what we've been
Yeah,
doing,
you're
so
right,
that,
yeah.
to that end.
You're
I
right, but then
remember
the
you
problem is
mentioned
if
that.
we're writing, well, it says 3 times a week and once at the wound
So-
care center.
3 times a week except patient goes to the wound care center. So I think that's how we should reward
Yes.
it.
Yeah.
Okay.
It has
Or,
to say 3
you know,
times.
And you might be getting into this later, but, or MD. Because you said unless they go to the wound care center or
Or
MD.
MD.
Because sometimes I've seen some patients that went to the doctor's office, he did it there too. You know, so I think just to, I mean, I think the biggest thing to think, just really think it over when you write it out. What am I gonna do? What will cover me one time in one order that I don't have to, every time I do something a little
Write it
different
again.
than this order, have to write something different.
Yeah.
You know, you know, think about what may came up and write the order. And you could always call Sharon or your supervisors too, but write the order to cover what you think you're going to, what, first off, of course, what the doctor's ordering, but how you would think you were going to actually be doing it. So you don't have to then send something out. We went on a Tuesday instead of a Wednesday, because the order says Monday, Wednesday, Friday. If you went on the Tuesday instead of the Wednesday, you didn't have orders to do that on that Tuesday. So you need to have an order to do it on
And
that
call, or
Tuesday.
and call the doctor.
So, instead of making the extra work on the second half, you know, think it over really clearly at the first half, exactly how it's gonna be done according to doctor's orders, and have the, orders spell it out, you know, really pretty clearly that way.
And include your PRNs too. Because wound vacs, hopefully they're 3 times a week, and if we have to go out extra, hopefully that's one of the 3 times and we just shimmy their
Times a week and
schedule.
PRN there.
But it may not happen.
There and
You know,
Yeah.
our PRN.
I don't usually put it in, I haven't seen it too often either, but shouldn't we have the PRN wet to dry thing in there too?
Yes,
Cause
so,
I tend
Right.
to put that
I
in.
so that actually should be, that shouldn't be in with this. That should
Should it be
actually
within the
be,
same order?
I would put it in a separate line, in a separate order, because you know how you have to click it off? I did that. So if you put it in here and said, oh, wet to dry, wound vacs off, then you're clicking it off and we're like, well, what did you do? Was the wound vac really done, or was the wet to dry? So I would put that in a whole separate
Is
line.
it possible to add like a, because you have care plans that you just press and it's there, right? Is it possible to add that wound vac care plans and the PRN after hours with, if problem with wound vac in the care plan, so it's easy just like to edit it, or,
The intervention,
yeah,
Yeah.
that intervention text?
we could do problems, but I don't think we could do like a full intervention.
Oh, you can, like
That's why
those
for
written
agents,
there,
Yeah.
some of them are already written that we choose.
That's why
them.
we didn't do the IB one.
Yeah, because of the IV, we were trying to do that to have them set, like MatrixCare was setting something up. So they let us, edit, which is, we'll get to that, they let us edit some of the problems, so like the impaired, the one that I tell you,
Yeah,
says impaired wound care and has a little star next to
Yeah.
it. So that's edited so that you could pick that. And then we were gonna try to do it with an IV because you have to put all that stuff, but
Yes,
the
yeah, so
interventions
it's
weren't
easier. They won't let
gonna
you.
be, because once they're there, you couldn't add like something different into
Yeah.
what type of sterile dressing they were getting.
Because the
It would
after
just be
hours for wound vac is
straight.
same orders anyway, so we cannot add the intervention.
What do you mean?
For the wound vac, like after office hours is problem with the vac, patient.
So you
with
have
the
to
vac.
add that, you have to add that in a whole separate line.
Oh, you cannot add it like in there. or
I
no,
wouldn't,
they don't
not
want
on
to.
this,
Not on
no,
the
a
same
whole
one.
separate line.
You're
Yeah,
asking
separate,
if
I mean,
Braintree can do
Like
it?
if Brightree can add it, that's
Oh.
what I mean.
No, we wish.
Yeah,
Cause we have an IB that's careful.
yeah,
I know,
So
yeah.
much easier.
it would be nice. Okay, where is the wound located? So we all know the body parts,
Mhm.
Okay, so I just kinda like threw these in because I was playing and all the
Can I have that picture?
front, left side, all the pressure areas,
They
you
have
know where they
that.
all are.
So I don't need to Google.
But the thing is, when you fill out the flow sheet, you don't really need to know the body parts because once you pick your X, this gets auto-filled for you, right? So you, wait a second. You pick the X, right? And you pick left, it automatically fills in leg for you.
Right.
Okay, so it does do that. This location is optional because it doesn't have a little line. So you can pick knee, which if it's the knee, I would pick it, if there's something close. You have to pick what type of wound it is. And you only stage it if it's a pressure and only degree if it's a burn, right?
So that one below it, the additional information is where you want.
This is where you would put the number 1,
Wound 1, 2, 3.
Yeah.
You want ABC or you want 1, 2, 3?
I think 1, 2, 3. What,
1, 2, 3, I think.
I think 1, 2, 3. I don't know, what do you think?
1, 2, 3? Okay.
Okay, 1, 2, 3. So when you put that in, then it actually names it for you. Surgical incision, left knee, and then I just was playing around, number 1. There's only one wound on
Okay,
it.
good.
Okay,
Oh, it does show it there.
Yeah,
yes.
good.
So now,
Confusing.
again, we're gonna put in an order and a care plan and everything. I'm just showing you some of the issues that we've had. So here's an order for wound care dressing change, left knee, right? With soap and water, apply alginate dressing cover with foam to be changed 1 to 3 times a week, PRN for soilage. So, when you're writing this, everybody goes to their verbal order and they write this. Does this screen looks familiar, right?
Yes.
Okay. Has anybody tapped on this?
Nope.
No.
Okay. Tap on this. This came in, I don't know, a few months back. Tap on that. When you tap on it, it pulls all of the flow sheet wounds in.
So you can choose.
So you put your wound in first in the flow sheet,
Yeah.
then you go to your care plan, and then you could actually pick which one it is. And once you pick which one it is, puts it right up there.
Oh, that's
Sense.
nice.
I even know that.
Now, the
What's
only
even
issue with
nicer about
this,
that, it will be exactly what's
it'll
on
be
the
exactly
floor
that.
plan. So
But
that you
of
match
course,
up.
there's gotta be an issue because there's gotta be. If it's the start of care, you don't click on verbal order.
Oh, yeah.
But only does that for verbal?
For verbal or plan, it says plan of care though.
Because a lot of times we have them written. Like if they come
Right.
from the wound center, they're written. So we don't
So,
need them.
right, so, I mean, I check over all the verbal orders anyways, and I stop them if I see it's in the clinical thing. So if you wanna match them together, you would have to do your care plan, click that verbal order, and then match them together. And that, I'm talking about start of cares. 'Cause that's the only way it works is if you do a verbal.
Also says start of care only.
Like if you click the little switch, yeah.
Oh, you
That
can do that in
box
start of
only
care.
shows up for verbal orders. That blue
Well,
will only.
you
show
can
up
pick
for
that,
verbal.
what I'm saying is you
It's
could
not
pick that into plan of care, but you have to hit the little
Cares,
button that
yeah.
says verbal order, and we're gonna do it, and you flip it over.
Oh, I see.
in the care-
You don't have to do that for a start of care ever, you don't have,
Yeah,
it automatically builds it. Am I confusing everybody?
Yeah, you have to show the care plan, but.
Okay, so we're gonna do it. So the little care plan button, you move it over, it says this is the verbal order, you move it over. It's not a verbal order. And yes, you could just make it a plan of care so it doesn't go out, but you still have to do that extra step to hit that button, which you wouldn't normally do on a start of care because
Yeah.
all of your care plans pull in.
Oh.
So, well, I'll show you. And this is just explaining that, is that the site on the care plan must match the site in the orders. When a wound is located and put on the flow sheet, the iPad MatrixCare will automatically name the site for you depending on where you mark the picture, and you can add a comment under additional info in the bottom right corner. Just use the same name. So when you're in the flow sheet and you finish the flow sheet, it'll say, it starts with pressure ulcer or surgical wound or gunshot or skin tear. Then it has where it is, left leg, left knee, whatever it is, right? So you have to, when you go to your care plan, unless you do that last step I showed you, you have to go to your care plan, you have to say, surgical wound, left knee. You don't want to be like, oh, they don't match. You have a care plan that's saying left leg, and then you have a order that's saying left knee. And it probably is the same wound, but it just, when Debbie's reading it, she has no idea. She's like, I think this is the same wound, but they don't match. The wording doesn't match. Does that make sense?
Yep.
Yeah.
Everything needs to match.
Everything needs to match. Wound care orders, we need to know the specific site, what we're cleansing with. primary dressing, secondary dressing, what we're securing with, and how often the wound care is being done and who is doing it, and your PRNs. So this is important. This is everything that needs to be in an order. Okay, so what are we cleansing with? I wanted to bring this up because I order a lot of supplies for you guys, and then I let you know. Oh, wait, go back.
For writing.
Oh, I'll print it for you. Don't write, you know me. No. I send it to you, don't you worry. I don't like pen and paper, you know that, Patty. Don't write, but she loves it. She's got a nice book.
I get it for the book.
I know, for the book. Soap and water, I wanted to put this in here because a lot of the insurances will not cover saline or wound wash. It's not me, it's the insurances, so try to get your orders for soap and water. And if not, then they have to pay for it, or we gotta figure it out, because that's a big thing. Your primary dressings, we all know these: alginate, Zeriform, collagen, gauze, telfas, foams, primary, they could be primary, secondary, and your border gauze. And I wrote it like this, although that was bad on me on telfa. Try to use generic names, because depending on what insurance, you guys may ask us to order something, and we try our best, but then they're like, oh no, they can't have this collagen, they can only have this, or they can only have that when we call. These are your secondaries dressings, and then secure with what we're securing with. How often will the dressings be changed? So this is what Kat was talking about. If the MD has 3 times a week, it must be done 3 times a week. We can't range it. So if you find a wound, like you find a skin tear, and you call the doctor and say, hey, I have a skin tear, I wanna put some foam on it, I wanna change it 1 to 3 times a week, because this week I'm gonna change it twice, and next week I'm gonna change it once and be done. And if you say that to them and that's the order you're getting, then that's fine.
Oh.
Then you could do the range, because that's the order that you got, and that's the order that came, you know, that you recommended, that you got over the phone, that's fine. But if somebody's saying to you that has to be done 3 times a week, unless you get back, hey, there's no reason. We need to do it twice a week.
So we can
And
still
range
put
it.
like 2 to 3 times. Like for example, for Cavalon Advance with Triad, we do 3 times. Remember, like we.
But you're
3
calling
times
it-
2 and then yeah, of course.
If you're calling, then that's absolutely fine.
Okay.
If that's the order you're talking to the doctor
Yes,
with,
yeah.
or whoever you're talking with,
Okay.
and they say, yeah, that's great, Lily, perfect, that's perfect. We
Okay.
just can't change, because I think that was a problem a while ago. I don't have this, because I think this was like a year ago, that there was a problem. The order was written for 3 times a week, or came to us from 3 times a week, and somebody rewrote it in the care plan 1 to 3, and then people were going out not 3 times a week. So, please do not write specific days. That should be on the schedule, not in the order.
So if the doctor wants it on those specific days, we have to do it on those days. So you could still do that, but that will mean you have to do it on that day or get an order for why you didn't. So just be sure that like you really have to do them on those days if you do that. That's most times you don't. That's the point. You know, so I would definitely always clarify it, and if they're so strongly wanting it those days, and you see an order Monday, Wednesday, Friday, that means we have to go no matter weather, no matter what, and do it on those days. So keep that in mind
Yeah.
if you ever have to write it that way.
If you wrote it Monday, Wednesday, Friday, and you were going
That's
out,
the days you do it,
and
that's it.
you were changing it that week because of your schedule, their schedule, whatever, you would have to call the doctor and say, I have to go Tuesday, Thursday. No, they don't wanna hear it from you. You don't wanna call
Blue
them.
bags are usually the only ones that they specify.
Yeah. Who is doing the dressing change? Wound vacs being changed 3 times a week. SBNA will change 2 times a week, and Wound Care Center will change once a week on days of appointment. SBNA will do dressing changes unless done by MD Wound Care Center family that is independent with care. And then you also need to have an order for removal of the vac to apply saline dressing by patient family, and they need to have a competency done.
And order the supplies, so they're in the.
And order the supplies. Oh, that's a good thing, yes. So if you have somebody who has a brand new wound vac, we have to order gauze.
That's the dries.
Yeah.
You need to teach them, so we
And you
want
need
to
to
go out
teach
at
them
night.
the competency. Who is doing the dressing change? All over-the-counter meds, I should have wrote lotions, not lotions, but your zincs, your triads. We have a lot of people have triads or have the zinc with your film over it, saran wrap or whatever they're putting on it. They need to have a competency and orders as well as who's doing the care. So for your zincs, your triads, your betadine to the toe, daily betadine to the toe. Daily betadine to toe! I ordered it. We need competency. And your dry dressings as well.
Is that one competency?
No.
Or do you have any more competency? Anything else on competency?
I have the competency page coming up. Yes, okay.
That's fine, it's
Okay.
fine.
We're gonna put in an order and everything. I'm just kind of showing some of the things that you brought up, so I wanted to bring the pictures in. When you go to put in your care plan, don't put in wound. Don't put in wound. Put in skin integrity with multiple wounds. There's 2 skin integrities, but if you think the patient's gonna have more than 1 wound, they're the same. This one I was able to tweak it to give you more wounds.
No, yeah, last year, few months.
So you could pull this in. So you have more wounds, because that was, Lily, that was one of our issues before. You pulled in the skin integrity and then there was only sight for 1 wound.
I remember the.
So even if they have 1 wound, this is fine because you put the 1 wound in. But this, it comes up, so don't put wound. So for the LPNs, because sometimes you guys will go out and find a wound, this is already there. There's some kind of impaired skin integrity, and then there's a whole nother wound flow sheet or care plan being started. And it's very confusing for the next person that's coming out. Where am I finding this wound? There should be 1 care plan for wounds, for all the wounds.
Sometimes I see multiple care plans for different ones too.
Right, so there shouldn't be. They should all be under,
If it's multiple wound, choose that.
yes.
Yeah, but she's saying even if there's only 1
Wound,
wound.
even if it's only
Yeah.
one, choose
Yeah.
that
So
now.
you have the
Not
option.
wound.
I
Just in
would.
case, you never
It's
know if
the-
another wound is gonna happen.
It's
and
the
then you
same,
can-
it's the same exact care plan. It just has more interventions. You'll see it. I mean, you've all seen it. It just has more lines for the interventions for wound care. Because that was one of the issues why people weren't choosing it, so we were able to add more lines. So that would be my I'm not saying you have to, I'm just saying, don't choose wounds. Do not choose wounds.
You're telling
There
us
should
not
be a
to.
skin
That you're
integrity.
saying,
I
that you're
Don't
saying
choose the
not
one
to.
that just says wounds,
Right.
because there's,
Wound care.
There's
Wound
the
It's
care.
wound
interventions
care.
are all
It's
there.
wound care.
all the
They'll wind
interventions.
up there.
Yeah.
Right, so you just pick the one.
Okay, so, I think I was just putting an order in, perform wound care dressing change, and that's that little, this is the button I'm talking about, Lily, that on admission, you don't have to hit it.
No, we don't.
You don't, but if you wanted your flow sheet name and the care plan to match, that's the only way you're gonna do it. That's the only way. That's part of the program. This is just a picture of the competency contract.
That looks better than the actual competency form.
I know.
So I
You should-
think,
you should.
You
uh,
should
so-
also.
so, hold on. So the one I got out of, the admission folder apparently was an old one.
It's
So
old.
when I asked Nancy, can you just send it, because it looked bad, I didn't want to put it on here. She goes, that's an old one. I said, well, can you give the one that you got to Jeannie to put in for admission folders? So eventually they will start coming in. So they should look better.
Can you make more space in between like where the procedure and the return demonstration? Because like I feel like just in general, like doing like IVs and stuff, I'm always trying to write everything.
Write it.
Nothing.
Can you
everything.
email that?
Yeah, can you email that to
I
us?
put it on the library and I can just edit so that I can just let them sign and then
Yep.
just save it and
Okay.
then
That's
put it
nice.
on.
Okay, and then you want more space.
Yeah,
Okay.
like where it says procedure, like you don't need
Yep.
that space where it says clinician name and describe.
So
Oh, yeah.
I could maybe see if we could move the header up too and then get more
Yeah.
space. So you just want this
Yeah,
and
yeah,
this
like you
thing.
don't need all that extra.
Got it, okay. Okay,
So,
okay.
one other thing about competency contracts, you need a new one for every time they change the wound care. So if, you know, or for several, or, I mean, you could put several on one, but if they do something new, you need a competency contract for that one too. So I was so excited when I was doing a review, and I'm like, oh, they have one for this, and then the wound care changed, and I'm like, oh, but now we don't have one for the new wound care. So, you know, keep that in mind if it gets changed. In terms of competency contracts, we are not allowed to teach private paid people to do it. We teach the patient or the family, and they can teach them to do it. So basically, they're going to be watching, well, we teach the patient and the family, and the patient and the family has to do the return demo. So it's return demo is part of that competency contract too. They have to do it once at least to do the return demo. We could then put that on them to teach their paid person to
They
do
really
it.
need to do
Well,
the
no, the
return
aide
demo. I
could do
thought
the
you
return
can.
demo.
Yeah, you
They're
think so?
demoing it to their
To the
family.
baby.
That's fine, thank
You're
you,
watching.
thank you.
Yeah.
Good, thank you.
Or
I'm
the-
glad
or
you
the-
said
all
that.
these-
I'm glad you said that.
You know.
Or the
Um,
patient will say, oh, can you just repeat back to your aide while I was, well, you know, whatever words I'm telling you. And also for competency.
Yeah.
The orthopedic group has changed their protocol for those knee and hip surgeries. I noticed it recently. Before, once you remove the surgical dressing, usually before it was open to air. Cover it only when it's sweeping, not anymore. It's dry clean dressing or dry sterile dressing until seen at the doctor's office.
Right, so we need to start ordering supplies.
Yeah, so as
Admission.
whoever does the admission and then that's the order written, please, order because today, I went to a patient's house, I guess, I sunk this morning like 2-3 times. I went to the patient's home, I opened the chart, there's no care plan, but then they said, it's there now, I sunk, it's there. But it doesn't say, like, no supplies order. Thank goodness I have ABD pads. I have to give like 7 ABD pads to last her for appointment next week with a surgeon.
If you call Dr. Morrison's office, he doesn't want it covered unless it's weeping.
No.
I talked to one of the
It
nurses.
happened to me Friday, 7 p.m. I met the husband here for an ABD
I haven't
pad.
gotten it changed by her because
Yeah.
she says, I don't want it covered unless it's
And
weeping.
it was
So
a
you
big
gotta
problem the
Morrison
next
doesn't
day
want it
with
covered?
Lynn.
call. Calling, you
Yeah.
gotta ask. Each patient's
Yeah.
different, but for the most part, she tells me no.
Yeah.
And I put that.
So her name is Catherine or Christine. She called
Kelly.
6 o'clock p.m.
Well, I just call them like that today.
Returned my call at 6 o'clock.
Yeah.
The patient had irritation
it's
with the
two
tape
ABD
and they
pads
said,
with
no,
with
I
these.
want it covered. They said, but the patient had irritation with the tape.
Yeah,
Then
just
improvise. Wrap it with A-strap. How will you wrap the hip? Or wrap it around the waistline and go around the thigh. You have to improvise. And I said,
And then she's gonna pee on
I
it.
said,
Right.
really?
And there's
And I
nothing
said,
in
I'm so
A-strap that's
sorry,
long
I'm not
enough.
in the patient's house anymore, you can call the patient. So she called the patient and the patient was upset. I called the patient, thank goodness I called her because she has having anxiety attacks. So I told her, you know what, I'm still here at the office, if your husband is good to drive, I'm here, I'll give you A-strap, I'll give you ABD pad. So she called the next day, Lynn sent the one nurse to do the wrapping, I guess, the A-strap around the thigh and the waist. I don't know.
No, the larger.
Ian.
stuff.
Do that.
Come on up.
They're really large.
Oh, yeah, I'm thinking people weren't
Yeah.
chatting.
Yeah,
Come on up.
the larger
That
fish-
big-
the
that big
larger
gets turned.
fishnet stuff.
Oh.
The fishnets?
Yeah, the larger.
This is the
larger one,
interactive
you
portion.
Just pull it up on the leg, not the hip.
You missed my dancing at the beginning. That was interactive.
Yeah.
Yeah, maybe, I don't know.
You
don't
know
need to
when
wear
you get
masks.
something
Oh, yeah.
that high.
Can you, put in a new wound? Where do we want the wound?
Oh my goodness.
Forehead.
Okay.
On the edge of the room.
Yep, we need a wound on, oh, here, you can sit. Come on.
Yeah,
You want a
I know
wound
you
on the
did.
forehead? What kind of wound do you want, Barbara?
Trauma.
Okay, so she had added wound,
Where, sorry?
forehead, she said. I'm gonna go over here because I can't see.
Oh, pains, like,
Yeah.
you gotta keep-
Where, in the middle?
Sure.
You said trauma?
Somebody get him.
Anterior abrasion. Anterior abrasion. Laceration.
So there's only one, I don't have to put a number one.
You don't, nope.
No,
Perfect.
it's the only one.
Do you want bilateral? I don't know if you want
I
bilateral.
think I clicked that, didn't I?
It did-
Yeah, it did.
Where?
Oh, maybe because it was forehead.
Yeah.
Oh,
Okay, so
So it says laceration. by
this is the one you just put in. Yeah, it says bilateral. That's okay. She didn't mean to put that in. She tried to unclick it. Okay, so is that good? Does that look good? Okay,
Wait, yeah,
hit
that's
done. Perfect. Woo! Okay, so now let's put in an order for this. You're still on duty.
Oh, in order? Oh, yeah.
You're right.
So if she puts it in here, it's not gonna pull into that visit for that day. You could go into, well, she's putting in a brand new one, never mind. She could go into, you could go into the care plan doc. Go ahead, you're fine.
I am in the
Keep
That's
going.
what she is.
I'm
She's
in the care.
plan.
If you're in the visit and you sweep, and you go into the, where the care plans are, if there was already
Oh,
already
yeah,
one.
yeah.
Oh, but I can't do
Go
that.
ahead, you're fine, you're good.
What is it under? Oh, I'm an RN.
Okay, so, come back in here, tap back up, please.
All right.
Only because, okay,
No, the
I guess
pencil.
it-
Pencil.
yeah, go back. Because she
It may
signed
not
it, she
matter.
signed in as me, but I wanted to show you.
Yeah.
So, yeah, hit this
Then
little
you'll change that to
pencil.
LPN.
Yeah,
So
there.
change the RN to LPN.
Yeah.
Even though we're signed in as RNs out, we changed them to LPNs, Ann, but you wouldn't know that, because yours just automatically does that, so you wouldn't know that. Okay, so perfect, so now go ahead, now we're gonna put in, our interventions. Can you just scroll through them so everybody can see? Just like do a see?
There.
Okay, so you've got a lot to pick from, but all of your other teaching and your assessment and everything else is also in here. So that's why I'm saying it's a really good one to pick. Don't pick the wound, you could pick impaired skin integrity, you could use it for everything. And then if I go next week and there's a wound on the foot, I could use it too and have all the wounds listed in one spot so everybody can see them all together.
Just make something up.
Yeah, good. Can the wife do it? Or the wife's gonna do it every day.
Every day.
Perfect, okay. And then, it was a brand new wound, so you had to call the doctor. So go back here. So you wanna hit your, yep, perfect. There should be some doctors loaded, so start at the top. And just stop right there for a second. So if you're doing a brand new start of care and you want them to match up, you still have to hit that button, and then Lily, like you said, you could just hit plan of care, but you have to hit that button, which you wouldn't have had to do it. That's all I'm saying, it's just an extra step to make a match. Yeah. Okay, verbal, perfect, you can hit done, and then you wanna select your wound. So this is the part, she just hit select wound.
For start of care, you know.
I think it's the bilateral laceration to the forehead. Perfect, she hits that, she hits done, it shows up right there, perfect. And you don't have to worry about the goal, but we do need a goal book.
Wait, so like, you can't see it in the care plan though? Okay.
Who can't see in the care plan?
It didn't put the name of the wound on the top in the care plan like it did.
Go
in the
back,
order.
in there.
Change wound to
So if
forehead.
you click on
She
it,
wrote
it's forehead. But you know how it said bilateral
Oh, yeah, the
forehead?
bilateral.
Yeah, I wonder if it's because it's test patient?
I thought that's it.
No, just not gonna
It's
show up, it's just in the order.
Do you
Isn't it in the wound?
do you recommend, like, if that wound care is daily, visiting nurse to assess each
Thank you.
nursing visit?
But, I guess my thought is that sort of, yeah, like,
I think
So
I
like
always
in
read
that
that.
order, it would say dry clean, you know, zero form, blah, 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 dry clean dressing daily, comma,
Yeah.
wife able to perform on days being.
Who's next? I need
Yeah,
another
when
somebody.
visiting nurse.
Somebody.
Yeah.
I write down when visiting nurse to assess each ill
Who's
nursing
next?
visit.
Who's gotta come up?
You
I
can,
volunteer Ed.
but then.
Ed.
You don't.
You got nominated.
Visiting nurse to assess each ill nursing.
Simone, come on up, see, you can't be quiet and hide, you have to be loud. You're not hiding, but see, you gotta be loud. Okay, so we're gonna go back, we're gonna put in another wound. And let's put in a wound vac. And where do we want the wound vac?
On the head.
Where?
The hip, right hip.
Yeah.
So you have to make the man dance.
Right eye.
Hip?
Yeah,
Hip.
HIP.
What
Hip.
is hip?
Oh, it is hard. It is hard to do.
So you gotta
That's
cancel out of
hard
there.
to do that.
Yeah.
I definitely
Yeah.
have to do
Add
that.
the wound. And then I would tap on the
chest
man first, yeah,
abdomen.
make him dance.
Yeah. Or like,
Don't get, it's so hard.
So
I
like
don't know
do
why
a
they
sweep
break it up like
on
that.
him. Perfect. Oh, that's his left hip.
left.
Yeah.
Right.
Good.
Perfect. Yay, okay. What kind of wound do we want?
Pressure.
Surgical.
Yes.
Surgical,
For sure.
like an healing. Right here.
Okay, and we do need a area and region.
Abdomen or lower torso?
I think because you hit on the hip, that's the hip and the groin, or like sometimes you have to go back out and go back in because
Oh,
that's
No, I
fine.
don't think
Yeah,
we can change that.
so you,
okay,
No, you-
perfect. That looks good. Everybody good?
Yes.
Oh,
oh wait,
It
Uh,
says inner.
Why inner?
oh,
They wanted to say outer, I guess.
no.
All the way up at the top, you put your onset.
oh.
Today's good, perfect.
Before it automatics, give you automatics.
Perfect. Then you can hit done,
No, you have to press it.
and we can hit done. And let's go in and write a care plan. So everybody's gonna help Simone write the care plan.
Oh, wait.
Oh, you could go in there and assess it if you want. I mean, that's where, does it, I don't think anybody has a problem assessing it. I think we just have a problem putting the measurements in.
The care plan and measurement.
Everybody knows because we see the assessment and we see that you're in there. It's just there's no,
We have
Measurements.
to measure Monday or measure
Is it
first
here?
visit of the week.
Am I in the right?
no, you're in the right spot. So we're gonna use the same one.
Only get measured
We're gonna use
once a
this one.
month.
Yep, let's do
So
each
once a week isn't
visit.
working.
Okay, and we're gonna
So
add a
it's
new
in-
intervention.
Perfect.
Perfect. And scroll down a little bit, because all we wanna add is a new wound. So, yeah, any one of those that are used, pick any one. Okay. All right, everybody, let Simone know, what are we gonna do to the wound too?
Bonus is done.
Today's date, perfect. And then just pop right on it again. Okay, nope, right where it was. This. I know, it looks different than your wound
So
one.
wound
Cancel out of here. It's right there. Okay, but that looks familiar. Okay. So cleanse with, what do we wanna cleanse with? Soap and water?
Yeah, sure.
Okay, and then what are we doing? We're gonna do a vac.
Oh, that,
I
I
forget.
forgot.
We could cleanse with soap and water. Oh, we're gonna put where it is. We would say left, and just make it at the beginning. There you go. You know, Clyde, do you like what you do for, what's his name? Clyde, black foam? I don't know, he has white foam?
Yeah,
Oh, he has a lot of stuff now. Just apply
Yeah.
black foam
could I do white first?
if you want to. Yep.
And should I put, what to put the wound back on?
I don't know if he's 125,
Yeah.
150. Continuous. Yep. HMHG, that's fine. Millimeters HG. That's fine. So it's normally mmHg, that's fine.
Oh.
Keep going. Continuous, change.
3 times a week.
Okay, so what do we want to write here? Let's say this is a patient that's going to the wound care center once a week.
Change 3 times a week,
two
except
times?
when visit.
So,
Oh,
but sometimes what if he doesn't go? Or,
but maybe you do a range?
but we don't want to do a range because they told us it has to be done 3 times a week. So we still have to say change 3 times a week, so we'll
Unless-
write that in.
Okay.
Well, don't say unless, just say change 3 times a week, we have to change it.
Unless done by wound care center.
Yeah, that's what I was gonna.
Unless
How
done
do
by
we
wound
wanna
care
write
center
this
or
one?
MD office.
Unless,
Change 3 times a week.
A visiting nurse,
Stratford
except on
DNA.
days seen by.
By visiting nurse, except Mondays.
Except for days seen by the wound care center.
Or
That's-
MD,
Or MD.
Or MD.
This one
I-
goes,
I
I
would
think
just
we
put
have a
that.
patient in mind, so
Wound care
thinking he
center
goes
or
to wound
anyone
care
else
center.
that
But yes.
But what if that
Care
region
center
has the
MD.
doctors ever, do they?
No.
And if they don't, then
Yeah.
don't do it. But if your patient might go to the doctors where they might take it off and do it there, you know, we still have
Perfect.
orders that we're
And
supposed to be doing it 3
PRN,
times a week,
because-
so.
This patient I know has called too, right? Okay.
Yeah.
So now hit your little verbal order.
oh wait,
Oh, does that look good? Concentration water, perfect. So she already has it as a verbal order, that's fine. And now hit the little blue.
Oh, the PRN though should have some reasons why.
Okay, we'll add those.
Why, PRN, why?
Surgical and Yep, perfect. So Deb wants reasons after the PRN.
Yeah,
Yep.
why would we have to do it? Soilage,
Displacement.
displacement, that's the other word. I was like,
Displacement's a good one. Displacement or leak.
Yeah.
I don't think.
About
that
just
happens.
dressing issue.
Yeah.
Dressing issue.
I always heard soilage and
You always do
displacement.
soilage and displacement. Which really usually,
So,
take care of the two.
and then like that?
Yes, perfect, and then hit done. But don't go anywhere, we have one more thing. Okay, so now this looks good, right? So now this person has 2 wounds, but this one has, the wound care, so we have to put in another intervention in case the wound back comes off. So we're gonna add another intervention. And then scroll down and just pick one of those at the bottom. Perfect. Tap on it again. Nope, it actually opened up. Yeah, there,
Oh, you
nope.
can't.
Fat finger, right there.
And they are fat.
Okay, there you go.
Okay, so.
And then you're gonna say, the left leg, left hip,
Right hip.
left hip,
Right hip.
Right hip.
right hip.
Oh, dear God.
Whichever hip.
Whichever hip.
No,
Right here.
So you put the same.
So what do we wanna write here for this one?
If problem with wound vac after office hours, patient/caregiver.
Yes.
Remove wound vac dressing, apply moist,
There you go.
wet to
It-
wet to dry,
Wet to
safe
dry.
dressing. And call Strasbourg VNA ASAP to schedule a home visit the following business day as early as possible.
Oh, you
Apply.
stopped.
To dry dressing.
And no, we're not calling them as soon as possible, we're gonna call them next business day.
Just put down, call Lily and put your phone number in there. Just call Lily and put her phone number in there.
Yes.
Okay, how does this look? Perform wound care dressing change if issues with wound vac, apply wet to dry dressing to right hip, family able to perform independently, and we'll call Stratford VNA.
In the morning.
In the morning.
In the morning, during
So
office
for
hours.
this one, we're not doing.
Well, no, they have, don't
Yeah,
you have
well,
to
yes,
remove the
I would do
wound
that.
vac?
Yeah, it
Yes.
says there.
This
Where?
is if woman will back apply wet to
How do
dry.
we know the family can do it independently?
Confident.
They're gonna
Confidence.
come.
Issues, apply what because
How do you get a competency, how do you get a competency form on that if it doesn't have to tell?
Instead of
It
doing
is
the
true.
wound one,
How do you
you
do
guys pick that
You
wound
can't
one all
do
the
a competency
time.
form on the
Pick
time
this
you.
one.
I
If
think
it's not there, then you're gonna have to
I
start
think for
over.
something like
There,
that,
when
it
they're
has to
ready.
be verbal
Oh, you
instruction.
have to go and get it.
You know, just document verbal instruction, because I mean, I can't.
Okay, so what's the issue? What's the problem?
No, I shouted out, well, how do we know they can do it
Because when we
independently?
do the wound back
We do the
dressing,
wound
we
vac.
teach them.
We tell them, we teach them.
And we document it.
But we don't really
You
return
can show
demo
that
because
for
they're
wet
not
to
doing
dry,
wet
and
to
actually
dry
do
at that
it.
point.
Just take
They're
it
not.
So we said verbal.
A verbally instruction on how to put a wet to dry on and document it should be fine. And if anybody has a problem with it, that looks at our records, we're gonna have to just,
I
We're
think the
gonna have
one
to just
thing
fight
that I
them.
would do if somebody has a wound vac is when you go to change it, have them take it off for you, because that's where the problem is. It's not putting a dressing on and taping it, it's the removal, because they're nervous.
yeah.
So when you go to change it for the first or second time, whatever, hopefully first time, go, listen, I'm gonna start pulling this off, I want you to just get your hands in here and help me, because if there's a problem, you're gonna need to feel what this film feels like, what's it's like to take it off, how to shut off the machine. So I would have them take it off, because that's really what they're
That's what
nervous
they're
about,
scared of.
especially if you have like the white foam and the adaptic and all this other stuff. They don't have to take the adaptic out of the wound that day, that stayed for a long time, that's fine, but they have to take that white foam out, and if it's tunneled or anywhere you gotta get that out, you can't move that in.
And they're-
So have them remove it, and you could have them sign that you watched them remove it. So,
And when you see them, just remind them about the dressing.
Every time
If it
you
comes
just
off, if it
remind,
comes
yeah.
off, or if there's an issue.
do we wanna do another one?
Don't call us,
Don't call me, I'll call you.
Maybe wanna do another one? This was pretty much what it was. It was just putting our care plans in the correct way, using the correct care plans, making sure that the care plan matches your flow sheet, because that's important. Questions? Is there anything else? Are we missing? Those were
So
all
a
your
couple
points.
Yeah, so a
Okay.
couple things that I want to just point out that I found. I had looked at 30 records. And a couple other things that I found, though, there was a handful of people that did not do a flow sheet
Oh,
at all
I can't fix
on their visits. So, every wound care, every time you do wound care, you have to fill out the flow sheet. And
Can I ask a question about
no
that?
flow sheet at all.
I've noticed like on a start of care, maybe it's something that I'm missing, but like, when you go through the whole start of care, you close it and you're like, oh crap,
You
I
forgot
forgot to
that
put
you
it
can
in
do it
the
at
flow
the
sheet.
beginning.
Is there a way to go back once it's closed and add it?
No.
Yes.
There is. Can you
Yeah.
show me how?
You have to let me know.
Yeah.
And I'll send it back to you.
Or me.
Okay.
Or,
Or
yeah,
Ken.
or Ken.
Anytime you forget
We
something.
ear copy it, yeah, and then it actually
yeah,
comes
no,
back
don't-
to you.
don't tell Ken.
Don't send it to Ken. He
Don't.
ears out your whole visit.
Oh
Only once.
That's all it takes. It was a learning experience. You hear what?
Listen,
Thanks for that.
I did it to a physical therapist for an initial evaluation for Kathy Lenosi when we first were on this. Thank goodness she loves me and I love her very much, and she did not kill me for it because I did the same thing once and I never did it again after that. So it's called an error copy, so we send it back to you. We have to put a little
I just
reason in
hit
there because
error, I meant to hit error and.
It's
Bam.
and then it comes back to you, as like,
myself
no,
doing that, so I gotta
you're
be
not
like,
on your own.
No, because if you already hit submit, you already put your initials on there. So then what happens is if we send it back to you, there's like a whole tracking in the background saying that Sharon opened it up and sent it back to you, and then I put a little comment why, and then you fix it.
I see,
Yeah.
okay.
So also for, some people will do it for mileage, but we don't have to send your mileage back. If you just tell us, we can actually add the mileage on our end. I mean, people are like, oh, I don't know, just send it back, and that's fine, but if you say, hey, it was 10 miles, I could just add that, but I can't add your flow sheet, you have to do that.
So another thing, for going back quite a few years ago, we weren't very good at doing length by width by depth. We always just did length by width. And we were informed that, everything has to have length, width, depth.
Maybe we were caught on a
Yeah.
state survey.
So we really worked hard on it. We got really good at it, and it became almost a non-issue. I never not saw, we were doing it all the time. And this was the first time I looked at a study, and we were missing quite a few depths. So different people too. So if it was just one, I'd make sure, do a little re-education for that person. But, a good amount of different people missed depths. We have to document a depth no matter what. It has to be, it can't be zero in terms of supplies, right?
Yes.
So we would want to say, you can't get a supply if you say it's zero.
Yeah, but Deb, there's some patients that we cannot do depths on if we don't know where that fistula is going.
Oh,
So I do
I
put
see
that
what you're
in my note.
saying. It's because it's too deep?
Well,
There's no engine, yeah.
If it's a
greater than.
fistula,
Then you
you
would
would
put
have
greater
that.
than
It has a
something.
greater than unless there's.
Okay.
You could do greater than.
Greater than one for a fish.
You measure what you can measure, and then greater than one.
Yeah, there has to be something and it can't be zero. It could be less than point something or greater than something, but, you have to.
I always did the L.
And
L.
done. Yes, and to order supplies
And
too,
then
there's
regular
no.
wounds, right, if you say the depth is 0 or it's 0.1, has to be 0.2
Yeah.
or more,
Oh, yeah.
they don't consider deep
Yeah,
enough
those
to
are
need
chronic
supplies.
So not even 0.1.
So it's gotta be 0.2.
So just put them as greater than?
So then it's just creating liars out of all this.
I know.
Yeah, seriously.
Kind of, right?
What I was saying, really quickly, so I'm in a visit here, so everybody was coming back into their chart to put it in the care plan, right, you see that? So all I was saying, which is fine, it's fine, it is fine, but if you're in the visit already, and I'm here at wounds, of course, like if you're with me, I always tell everybody sweep, because there's pages that are being missed, like this one. So people are coming up, just hitting their menu up at the top, and they're not going into infections, so I'm just saying. So if you sweep through, which I'm doing here, so if I come here, I could hit the pencil, and I could add my intervention here. Already in the visit, I don't have to go back into the record. That's what, I'm here, right? Here's my impaired skin integrity wound. I hit the pencil, and then I add my intervention. You don't have to go back into the record.
Oh, I didn't know that.
Yes, so you could do that. You could do either one. It's not wrong, but if you put it here, then you could actually say, check it off and say you did it. Whereas if you put it there, it doesn't pull because your visits template's already loaded. It's not wrong because you're gonna have a note with the new orders and everything, so it's not wrong. I'm just saying, you're already here, why not just stay in the visit? Either way, it's fine.
And if you remove a surgical dressing for a hip knee surgery, please measure it. If you're the one, you know, I've been seeing patients in the last nurse who removed my surgical dressing, they measure it.
Oh, and yes, and
They're
also,
supposed to measure it.
anytime like you DC a vac or start a vac, something like that too, you need to measure too, because that's an insurance thing. We actually have a problem with somebody in not wanting to pay for vac now. But you need to have measurements. So if you had a new wound, of course you're gonna do a measurement, brand new wound, no matter what day it is. But if you have a brand new vac and it's like on a Friday, it's not a measure Monday, you should measure. If you're starting something new, like a vac or something different, you should measure.
What
If you
happens to
take that
measure
off,
every visit?
you should measure. Huh?
What happens to measure every visit?
That's on my list. So I have a couple comments too. So we say measure every visit because no one's doing it once a week.
And so
And I know everybody's gonna tell me they're doing it, they're not.
I have to,
There's
out
some
of
wounds that were
the,
measured once a month.
out of the 30 records I looked at, only 13, which is 43%, had weekly length by width by depth of all their wounds. So less than half,
And there are
13 out
times
of the
where,
30.
you know, I know you can't see your own patients. So other RNs are seeing them, LPNs are seeing them, and being seen on the weekend. So it's not like you're the only nurse going and you know, well, I measured this wound 2 days ago, I know I measure, you know, all my wounds on Wednesday or whatever, or it's Monday or whatever the day is. We tried doing first visit of the week, that didn't really
Measure
work either.
Mondays, yeah.
I thought we were doing every visit.
So if we measure every visit, then the chance of missing them, we just decrease that, you know, risk by quite a bit. And if the insurance company, there are a few literally, you know, that somehow help Jay, I'll call because they want a clinical update, they wanna know the exact measurements, they wanna know if there's tunneling, they wanna know if there's underlining, how big is it, what color is the drainage, how much is it? And I'm going off your flow sheet, and they'll say, when's the last time it was secreted? And, you know, if your flow sheet has been filled out in 3 weeks, I have to fumble through that. Because they don't wanna keep paying for supplies and visits if we can't even tell them how the wound's doing.
And the supply companies ask for measurements too.
Yes.
Yes.
And how do you get surgical supplies if you can't measure the wound? How do you get the supplies? I don't
For
know.
the hip and the knee, now they want dry sterile dressing
Well, I never
after
got
removal
into
of
that
the foam.
situation.
Are we giving it to
Well,
them for?
there's been times where you guys didn't have them because it's a new knee or hip or something, but there's something on the W10 or someplace we try to find something. Sometimes I've asked Jen, like,
How was the
because they'll have like the incision length or they'll have something that we could pull in.
Yeah, these doctors want these dry dressings, they need to send them home or something.
Yeah, they really should, but yeah, they really should. Because that's a problem too, like you said, there's no, what if it's just the dry dressing?
Yeah, and that's what they're telling us.
Well, that's what they want on the
Yeah.
Well,
hips
that's
and
what
the
they
knees.
want,
Supplies.
and we don't have
Yeah.
measurements,
Yep.
so then what are we gonna do? I'm sorry. Ask Jen for measurements?
I've asked Jen sometimes for
No,
hip
sometimes
surgeries
we
or
do
something
that.
on the W10.
But if you need a dry dressing, because you're taking off that surgical dressing, you should measure it.
Oh, yeah, well, yeah,
But
Otherwise-
you're already there.
well, we're there, like, we
Yeah.
need supplies.
Otherwise, I might have to make up how long that measurement is, because if I can't look into their hospital record and find easily that they measured it, which good luck with that.
They're not putting it, they're not.
Yeah, and if it's really just an incision and we're covering it, if it's, you know, any sort of wound with any sort of, you know, depth or width, it's a totally different story. They have to be measured. And honestly, going back to the pictures Sharon showed in the beginning, it really is your license when you're out there. And that wound in the beginning wasn't to like say, oh, somebody didn't do what they were supposed to do, you know, shame on you. It's because that patient did already lose their leg, and he was not going to say anything. If he doesn't keep that leg, If we didn't see that and PT didn't happen to visit that day, he was not gonna call us.
Cause it was a Friday.
No way, we would have gone out like the next Monday or Tuesday to assess him, and, that would have been completely macerated.
just
His whole
oblivious.
foot would have been macerated, he probably wouldn't have even taken that boot off all weekend.
Probably not.
He would have
We
had
end
a
up seeing him all
on
weekend.
his leg. And it would have gone back to, well, yeah, the cast off, we made a visit, did we look at it?
Yeah, exactly.
What happened? And it would have gone back to the nurse that was there and any of the staff that visited, that patient. That could happen any day of the week with any patient. Your patient's not very mobile and you don't look at their butt, you have no idea what they're sitting on. Years ago, long time ago, we had a patient who was always in her chair. Slept in her chair, ate in her chair, never got up. No, honey, it's okay, I don't wanna get up, you don't have to look, you don't have to look. Well, the truth was she was never getting up from her chair. Literally never. So her entire bottom was open, exposed, stuck to her chair because she wasn't getting up. And how many nurses had gone, no, it's all right, she doesn't want me to. They're assuming she's getting up and going to the bathroom, and she wasn't.
And I couldn't smell it.
And somehow
Like this morning, yeah, this
Yeah,
morning,
okay.
it started this morning, I did a home health aid orient. The patient is morbidly obese, like 400 pounds, so she doesn't wanna get turned when I went for the orient, so she wants to be cleaned first. Stop here, I've been standing there for like 37 minutes and the aid is not done with the front first, so I need to see the butt, but I'm late for my next visit, so I went back to see that buttocks, and she said, you really need to see it? I said, I really need to see it, I'll be in trouble. I said, no, I have to see it, I'm so sorry. I said, I have to, and she was not happy about it. Said, you can call the office and complain, but I really have to see that butt. I have to really see it.
Yeah, and during your visit, you're saying, what are they at risk for,
I told her, I really need to see it.
Dehydration, immobility, it could be their, skin, all their bony prominences, if they're really thin and tiny, it could even be their ears, it could be, the tops of their shoulders, their shoulder blades, whatever it may be, but you have to pee. And there are times where they will adamantly refuse, then it has to be something that we have to look the next day. We have to bargain like that. And the LPNs, if it's something you miss, you could be in trouble for your license, and so is the RN that's the case manager, because you're working under her. And then so are we. Everything you do, we are responsible for, and everything you don't do, we're responsible for, whether it's measuring it, we didn't really adequately teach a caregiver, we don't have proof we taught a caregiver, it's not in your note, and we don't have a paper, then, something bad happens, or they say, they never told me that, or I'm not doing it, or they never said, whatever, X, Y, Z. It will all come back down to, what did you show them, what did you document, and hopefully you never get in that situation, but it really is your nursing license, and possibly the nurses you're working with, if you're not following through and doing these things. That week that PT saw that leg, that was the third patient that week he had gone to and felt like there were skin issues that the nurse didn't know about, he was finding them. So he felt like, I don't know what's going on, but I'm a little worried too. And sometimes in the schedule, if you're off or there's a lot of patients to see, you have a lot of admissions, there's different people going, we can't lose track, of what's going on. And sometimes I feel like that's how wounds don't get measured, because different people are going and someone's assuming somebody else is gonna do it, or supplies don't get ordered, and again, you're out there and then you have an order to put on something you don't have, you can't just replace it with something else. And if the wound care order says Monday, Wednesday, Friday, and you're like, why am I here on a Tuesday? I don't have an order to be here on a Tuesday. Maybe we need to change that order, or maybe there's a problem. The other thing I'm hearing, I've heard probably 3 or 4 times in the last couple of weeks is, well, she doesn't really have an open area, but we're wrapping her legs with dry dressings 3 times a week, and she just doesn't want me to stop. No.
Pay for those supplies.
That's not even skilled care.
Even ACE
3 times a week, we have way too many patients that really need us often to do that. And sometimes we have to be the ones that either push the patient or push the doctor to be like, can't be done. Or you're going to have to learn it. And if you can't wrap it, then there's other types of wraps that are Velcro and different things that stay on, or ACE wraps, or your family member. We can't be the one to do that.
Yeah.
If they have other issues going on, or their skin just healed, so it might open back up, We could do that maybe, once a week for 2 weeks, and then that's it, if they have nothing else going on. The other thing is painting with betadine and then wrapping. That's not skilled either. Betadine's never skilled. And then wrapping on top of, a not skilled doesn't make it skilled. And there are times we're doing it 3 times a week. I don't know what we're doing. And we have wounds that are, really big and weeping and that need us. Those wounds don't need us. So if it's your patient or someone else's patient, you need to talk to them and just be like, hey, I don't know why we're going this often. Or, maybe stop and think about it for a minute. We need to change those orders. And sometimes, well, they're going back to the doctor, and I'm like, when? 3 weeks? No, not good enough. Not good enough. A really simple dressing that's barely deep, barely big, barely draining, we're going 3 times a week? No, it doesn't need 3 times a week. They're not managing that drainage, and if it's on its way to healing, we need to change the orders and cut it down. So with wounds, there's just a bunch of things that were kind of concerning. It was a while since we had a wound service too. We thought it would be really good to show some of the screens. That's always a good thing. And maybe some tips on some things, as well. If you come across things that you have questions on, or you're not sure if it's a skilled dressing, or maybe you need help cutting it down. Some patients and families get very nervous. The nurse doesn't come. Maybe they used to have wounds. They think they're going to come back. It still doesn't make it okay, and it's not skilled, and we can't be doing that. So just keep that in mind. Literally last couple of weeks, I think 3 or 4 cases like that came up. I think 2 were in QI, and I was like, what? What is that wound care we're doing? That's nothing. And then they showed up in our QI report, on top of it. So I wanted to make sure, I mentioned that, as well. And if you need another suggestion of what to do, Sharon is a great resource. Lily's a great resource. I can answer some questions. I'm not as great as they are. Sometimes I like stock answers for things, but, we can help, with that too. But we have to be thinking that with some of these patients, because we're just really wasting visits. Any questions about that? Stage 9, death, you mentioned that. Oh, provenous. So something we haven't seen in a while either is some of our hips and knee patients, after surgery, they're putting a provena back on. And we haven't seen those in a long time, but lately we've had a bunch of them. So it would be good, because some of the patients have called on call, because they're like, oh, it shut off. It's alarming. Day 7, they shut off. And they'll get, I think, warning noises and stuff. So that's normal. It's okay if it shuts off. They're supposed to come off on day 7. Usually the doctor wants us to take them off. But let them know that, because I think 3 patients have called the on-call in the last couple of weeks too. And then,
they're supposed to
can yeah, and also in general, there's probably another visit after the admit nurse to day 7, because they probably didn't stay in the hospital very long. Just make sure that, that they know that, and your visits are in line, so day 7, we're taking it off, if that's what they have. In the care plan, it would be helpful, or somewhere in your notes, it says Provena vac, because otherwise it says vac in place. And I'm like, wait, how come we aren't going 3 times a week? What? I don't understand what's going on. So those just kind of reemerged lately, too.
Can I ask a question about that? I don't know if anybody else got it, because my patient came home from the hospital, but I don't know, I think her vac wasn't, charged all the way, because there's 2 lights, right, where the battery, and that's why she called, I think, and that's what happened,
That's right.
but
They sent her home without the charger.
But
Yeah.
the hospital said that they never send them home without a charger. I
Really?
mean, they never send them home with the chargers.
Yeah. Cause that one,
So I didn't know.
So look, it was this whole, I was there for an hour trying to figure it out, cause I called the doctor's office, I called the.
And we don't have them, we can't get them.
We
don't get
Right.
chargers
either. We'll gather our throwouts.
Well, yeah, she's gonna give us that charger.
We're gonna use
Can we
Yeah.
use
I didn't even
anybody's
know they had a
charger?
charger.
I
Me on
should-
call, they were looking it up.
I asked if she had a charger, she says, no, they didn't send me home with a charger, so then I said, well, there must be batteries, let's look for the complaint for the batteries, and she couldn't find it, because it wasn't that one.
Yeah, some of them have a charger, some of them have batteries.
And
I
then your
actually,
handout is beautiful.
yeah, I actually pulled a handout
It's
from,
fantastic.
online, so I'm gonna make copies, I'll put it on everybody's desk. But it's
Really
kinda
good.
like troubleshooting the Prevena vac if,
Yeah.
there's not a
It's
lot of
color.
troubleshooting to be done, but she couldn't find where she, inserted the charger into the vac either, so it's got pictures on it and everything, it's a really good, tool.
And then just one last thing, comment for me about,
It has to be dry, too, that's the other thing,
Huh?
if you take it off, the Prevena, the dressing you replace has to be
just dry
dry.
dressing, right, dry cover.
Dry cover.
A lot of times the Prevena, they don't even want anything on it after unless it's.
But not
clean.
wet to dry.
Not to wet dry, absolutely not.
And
Yeah.
Just as an
Regular
example.
vac, yes.
Just as an example.
Oh, yeah, I didn't even think that through.
There you go.
So also with our hips and knee patients for nursing, some of them go to outpatient like 10 days, 2 weeks, some stay with us. 5 weeks, 6 weeks, they don't go to outpatient, they keep PT. And we seem to just keep nursing right up until
More
the end.
visits.
They don't need you. I'm
More
telling you right now,
visits.
they don't need you. We say we like to really have 5 or less nursing visits.
Yes.
Some nurses do 5. You don't even have to do 5.
3 is fine, explain.
Admit, depending how long, they're home, if you have to take a Provena off or whatever, you're gonna plan that day 7, whatever, and then after that, maybe go back in a week. And if you're good, you're done.
You gotta remember rehab, they did their,
Right,
Nursing
pain,
stuff up.
you're just really, their pain, their bowels, the first few days, their blocks wear off, and then you get the pain spikes, sometimes we get calls from them, they get really nervous. Go over the pain management with them, you expect that.
bruising, yeah.
Bruising, their bowels, and then let PT kind of do the rest. If it's just literally an open incision, they have a dry dressing just to cover it, but really you could just peek on your seat, PT can do that.
Yeah.
So they can also, look at the incision too.
So I look at like 100% of our total joint patients, and the 5 visits or less, if you are making over 5, I need to see the documentation really clear on why. I don't want, often I have to try to well, maybe they went because of this or this. It just your negative documentation just has to be there for those patients, so I can understand why did we make more than 5. And I'll see it often, but then I'll often not see it and try to see I have no idea why we went more than 5 times for this patient.
Yeah, once in a while somebody has an open area.
Yeah, there's sometimes it's obvious, so I don't, even bother worrying about it, but sometimes it's not obvious at all. So that goes back to your documentation, because even a few times I'll maybe even send a Tiger text why, and they'll explain it to me in the Tiger text. But I want to know, well then, great that you can explain it to me, but I should be able to see that really clearly in your documentation.
That meeting nurse for that hip and knee surgery before, he will always put twice a week until I think I texted the supervisor or him directly, if
He still does.
it's a hip and knee, the nurse has to go back to remove the surgical dressing, and then we can go back after the appointment with the surgeon for discharge. But it's still the same, it's twice.
He's still doing it.
What do you mean?
Twice, for example,
He'll put a range?
Yeah, no, it's.
No,
he'll
he'll
put it
say
in
he
the
met somebody
calendar.
today.
Yeah.
He'll put him for Friday, just
Yeah,
because.
revisit Friday.
Armando? Yeah, he does that a lot. He'll
I thought we
admit him on
already
Tuesday
told
and put him
him.
in for a visit on Thursday or Friday.
And you're like, why?
Because
I think he might,
Either that or he doesn't wanna wait till Monday,
Tuesdays
But
are
then he'll
hard.
bid somebody on
But I think,
Monday.
I think he's,
Tuesdays are hard.
I think he's getting better about it. I think
Wednesdays
he's
are
gotten
hard.
so-
Yeah, I think they're going out.
I think he
It's
was-
some more visits.
Yeah, I
It
think,
was, I didn't wanna
it
say
was
no.
mentioned, it was
when he
mentioned to
promised
us, I
it.
think that's a little bit better.
Yeah, I think he,
Are we upset?
Yeah, anybody else have any other questions or anything?
I'll tell Debbie about the hip. We'll see more than a full-time.